The shock which results from the severe allergic reaction को क्या कहते हैं? इसको कहते हैं anaphylaxis is what you need to remember. So how will you recognize that there is anaphylaxis? Very good to see 5 online students. Roja from Vizag, very good, is asking why the eosinophil count will increase in allergy, sir. Badhiya, bahut acha question pucha Roja. So whenever there is any allergy, right? So the allergy will make the WBCs, white blood cells. What are the types of white blood cells? Do you know, Roja? You have neutrophils, eosinophils, basophils, etc. So this basophils are the ones which will go and make mast cells to produce histamine. That is one way. Second, the allergen will make the immunoglobulin E antibody to become produced. That immunoglobulin E will make eosinophil count to increase is what you need to remember. Got it? Now, Roja is very sure why the eosinophil count will increase in allergy. Right? Now, these are called hives whenever there is anaphylaxis. Inside our eye, we have conjunctiva. So there is a swelling of conjunctiva. These are the things that happen whenever there is an edema, is what you need to remember. So, Roja, tomorrow you should, Roja, you have done diploma nursing or BSc nursing. What did you do? Right? So, you can bring a lot of your friends also to join the session. So, ask them to subscribe and then click on the bell sign. The moment we start a session, you get the bell sign, ring up so that you can be able to participate. The great advantage is everyone has got a YouTube channel. I mean, YouTube in their smartphone. So it's very easy to participate from anywhere. You can be able to participate in the discussion. So that is the purpose with which these sessions are started. So remember that we will totally discuss 8,000 MCQs from the 14 nursing subjects, right? And by the time you revise this, you know to crack any kind of a staff nurse recruitment exam, right? Now, whenever there is an anaphylaxis, what will the problem? There's a lot of edema. Edema is the fluid which is leaving the blood vessel, right? So that can lead to blockage of the airway. So there can be problem in breathing. The BP will fall down. Circulation mein problem hai. So how do you identify? Generally, anaphylaxis is very acute reaction. बहुत acutely होता है anaphylaxis. And there can be a life-threatening airway blockade that can happen. That's the reason, as a nurse, what is the thing that you need to do? Call for the help, make the patient to lie flat because he's having hypotension. Raise the patient's legs and then get ready with adrenaline. Adrenaline is going to make the anaphylactic shock to reverse. So fundamentally, anaphylaxis mein BP kyun gir raha hai? Why the BP is falling down in anaphylaxis is a very important question. BP is falling down in anaphylaxis because in anaphylaxis, the mast cells are stimulated, releasing the histamine, and that histamine is increasing the permeability. Permeability means the blood vessel become very leaky, and that will make the plasma to leave out of it. So that is causing the low BP. If you happen to give adrenaline, it's a strong vasoconstrictor and maintains the BP. So what are the other important things that you should get ready when the patient is having anaphylaxis? You should get the endotracheal tube ready so that you can establish the airway, high flow oxygen, then IV fluids, then hydrocortisone, and you should have pulse oximeter kept ready to monitor the saturation of the oxygen. ECG should be ready. and BP apparatus ready. So these are the things that you need to keep ready in order to attack. An attack of anaphylaxis is what you should remember.